This is Bristol. Bristol is a big city in England and lots of families live here. Bristol is also the home of a big hospital whose job it is to look after all the children who live in the city and towns nearby that may need to come to the hospital from time to time. Lots of people come to an emergency department when they need to see a doctor or nurse for urgent help, such as when they are very sick, if they get a bad injury or anything else happens that can't be treated at home, by their GP, or at a minor injury unit. Lots of different children with different health emergencies come here. We're going to have a look at what happens when children come to the emergency department and what to expect from your visit here. When children first arrive with their families or carers, they need to book in. This is where they are greeted by the receptionist who asks about their emergency and takes some further details. Once this has happened, they may need to wait a little while to be seen by a nurse. At the children's emergency department, children will be seen by lots of different healthcare professionals, including nurses, doctors, emergency nurse practitioners who are specialist nurses, healthcare support workers, students, and sometimes many more. After booking in, the next person you will normally see is the triage nurse. Triage is all about assessing how urgently each child needs to be seen by a doctor or specialist nurse. They will ask about the emergency in more detail and then take some vital signs, such as temperature, oxygen levels, heart rate, and take any other necessary observations. After this is done, the nurses and doctors will have a better idea of who needs to be seen first. For instance, if a child is struggling to breathe, it is likely that they will be seen more quickly than someone with a minor injury. We see children in the order of urgency. This means that you may see children who arrive later than others being seen before them. If your child was the sickest in the department, you'd want them to be seen very quickly. So we see the sickest children first, or those with the most severe injuries. When it is their turn, children will be taken through to the main department and be seen by a doctor or nurse practitioner. They will talk to you and examine the child and give advice. They may organize tests, medicines, or other treatment if it is needed. Sometimes there can be a bit of a wait between seeing the triage nurse and being seen by the doctor or specialist nurse. This can be up to or over 4 hours for minor presentations at busy times. We know this can be frustrating, but we're grateful for your patience. Please do be nice to our staff in the meantime, as they're working hard to get you seen as soon as possible. Some children may be asked to move to the carousel outpatients department down the corridor to be seen there. This does not mean they are seen quicker, but means everyone has a bit more space. After coming to the emergency department, some children can go home straight away if the team are happy that they will be able to get better at home with some top tips. Others may need some extra help to get better, and so they may need extra tests on the day. This might include doing x-rays or blood tests. Blood tests normally take about 2 hours to come back once they are taken. In some cases, children might need to stay in the hospital for a little while. They could go to the observatory, where the nurses and doctors can look after them for a short period until they are well enough to go home. This could be whilst they're receiving treatment, or sometimes waiting for investigation results. Sometimes children may need to be admitted. This means you might move out of the emergency department to a ward in the hospital and stay there for 1 or more days for extra medicine or care. Sometimes there can be a bit of a wait whilst a bed is found upstairs in the hospital, as there are lots of sick patients already there. Please do let us know if we can do anything to make you more comfortable during this time. We know coming to the emergency department can be difficult, and it can sometimes take a long time here. It can also be really busy and quite loud. To make sure everyone with an emergency can be seen quickly, there are lots of other places where children can get medical advice and support if they do not have an emergency or serious urgent problem. This may also mean you can be seen quicker with a less urgent problem. This could be making an urgent appointment with your GP, who may know you better and may be closer to your house than coming to the hospital. Ringing 111 for advice on the phone. They may be able to book you a GP appointment or give you advice on what is best to do. You are welcome to ring 111 while sitting in our waiting room at busy times. Visiting your local pharmacist. They're great at giving advice on coughs, colds, minor skin problems, and many other minor conditions. If you've had a minor accident, then go to the Minor Injury Unit or Urgent Treatment Center. They're specialized in caring for people with minor injuries. You can also find lots of information on these topics and others on the Handy app, which can help to direct you to the most appropriate service. There's also great information in lots of languages at www.what0to18.nhs.uk or on the NHS website. These services might save you a trip here or suggest other useful things you can do at home to make your child feel better. We hope that you've had a positive experience in the Children's Emergency Department today, and we're always open to your feedback. Feel free to fill out the Friends and Family test surveys to let us know how we can improve. From all the team here in the Children's Emergency Department, we wish you all the best and we hope you feel better soon. Thank you for watching this video.